It's a pleasure to be here. I hope over the next little bit to impart some of the wisdom that I've learned over the years in my career. And it's so necessary at this time to talk about this topic. When a number of weeks ago, when I had a chance to talk to Daryl about what we could do to help impart some practical advice, some common sense approaches about stress, resiliency, and how we can take care of ourselves. I thought, it's a really good time to just talk about what stress is, what resiliency is. Because often in times of difficulty, we hear these terms, bounced around, but what do they really, really mean? And as a mom and as somebody who works, this past year has been, for me, for my family, for my friends, for my colleagues, has been surreal. It's been, we talk about certain terms like this is the new norm, or this is unprecedented times. But what we often don't look at and reflect upon is every day, what does that mean for us? So to give you a little bit of background about myself, I'm currently a mental health advisor, a senior advisor for the Royal Canadian Mounted Police. But over my career, I've worked in several clinical settings, research settings, government settings, and I've witnessed, unfortunately, some of the worst and the best of what people can offer. And oftentimes we see in times of stress, and that's an impetus to talk about what it does to us in our most vulnerable times. We see it impact upon not only ourselves, our family, our children, our colleagues. And I'll digress for a little bit. One of the earliest career jobs that I had was after I obtained my BA in psychology. I was a licensed social worker, and I was doing the area of child protection. And in that role, I saw immense pain, trauma, suffering. I saw the best in people. Saw the worst in people. But the one thing that I saw was overwhelming is people can endure a lot. And we often don't give ourselves the credit that we deserve when we are undergoing very, very stressful situations. And unfortunately, this pandemic, although it was a catalyst to have this really wonderful conversation about what stress is, it is a catalyst to have a broader conversation of what stress is in the full context of our daily lives. It is something that we all work through, whether it be juggling work-life balance, financial, family obligations. I'm learning what virtual learning is from an elementary school perspective as a parent. And every day I go, didn't see that one coming. How do I handle this? So I know we're all wearing a lot on our shoulders right now. So what I thought I would do is today I'm going to talk about just stress. What is it? What does it mean? There's a lot of negative connotivity when it comes to talking about stress. But actually, we have stress in our lives to serve as a reminder call. It tells us, hey, Houston, we've got a problem here, and we need to deal with it. So stress can be bad, but it also can be something that we use to grow as individuals, as community members, as family members, and better colleagues as well. So it's not all bad if we handle it right. So tonight I'm going to talk about stress, what it means, how to look for it, what to do if you see certain things. And then in the coming days, we're going to do part 2, and we're going to talk about resiliency, because to me, they go hand in hand. Stress is needed to build resiliency, and it's a skill that we all learn. Like any skill, like I often liken it to being an athlete. Some people are born with certain skills and they are better at certain areas. Resiliency is no different. but we can all achieve a resilient life if we put the work into it. It's not something that comes automatically. We learn it as a skill, and if we practice it in our daily events and daily situations, we can become better in it, and almost it can become automatic. So before we talk about resiliency, let's talk about stress first. So what is it? Well, it really is subjective. That means it's up to you. What I find stressful, you may not. Your family members may not. Your peers may not. And it often becomes difficult because when you're saying, I'm having a stressful day, and if you're communicating that with somebody, they may not see the same events as being overly stressful. To also complicate things is what I find stressful today, I may not find stressful tomorrow. So stress is something that is triggered by the body to say, time out, we need to address it and deal with it effectively. So it can be something that is real in your life, or it can be even perceived. We hear terms such as anticipatory stress, worrying about something that may come, or anticipating an adverse event that may occur as a result of everything that's going on. Regardless if it's real or perceived, the body doesn't differentiate. It doesn't see the difference between the two. So stress, real or perceived, is something that the body's saying, okay, let's handle this in a more effective way. But what it does, this is going back to my neuropsychology days, where the body is pretty fascinating. And it triggers a very typical response. So our brain doesn't understand, well, it does, but I'm going to simplify things. It doesn't always understand that we have to have a choice of fight or flight. All it knows is it recognizes something and it tells you there's something here that's concerning me. So the body responds in a very typical way. You have that fight or flight. That means there's neurotransmitters, there's hormones going on in your body that says we have to react. But what that does is it allows us to very clearly figure out how to get out of a situation. So that means I can run, I can flee, I can respond, I can use my voice, I can do anything I need to do to get me out of the situation. But we've evolved quite a bit over the years. What hasn't evolved is our ability to deal with what we call chronic stress. Chronic stress is an evolution out of our lives now. We're balancing so much more than we ever have. There's a lot of benefits to our culture, our society right now, but that also has some negative effects. And what research is telling us is that this chronic stress is actually doing so much damage to us, to our bodies, to the way we perceive things, the way we react. And if we don't come to terms of how to deal with that over time, our body's going to break down. So part of these chemicals, what they initially do is they have some very predictable features, some predictable ways that the body goes, okay, I need to react. Well, the first thing you may notice, your heart starts to race. If you're ever nervous about engaging in, like when your friend asks you to do a video chat, your heart starts to race a little bit and you get a little nervous. That's normal. That's your stress response. But it also makes you have more glucose in your bloodstream, so your muscles are more primed. It stimulates your breathing. It does a lot with your insulin. And all of these things physically get you out of a jam. But what happens when your stress level about juggling parenting, your parents, your aging parents, your work, finances, whatever it may be, what happens when your stress level stays elevated over time? Well, it has impacts on four big areas. And the first one is our physical. How your body reacts has a detrimental effect if these chemicals stay engaged day after day after day. It also plays a negative role on our psychological, our mental well-being. How we feel and experience over time changes if our stress response remains elevated for days, weeks, months, even years on end. The third thing it impacts upon is our social interactions. When you're in times of chronic elevated stress, our reaction to our social environment changes as well. For some, you may become more engaged with others, but for a lot of people, you become disengaged. You're not as likely to want to meet and talk to people who could help you out through a stressful time. But it also changes your perception of your community around you. What it does is it makes you feel less likely to trust the environment. And as a result, it can fundamentally impact long-term how you view your social context. The last thing that stress can do is what we talked about is existential or spiritual. We can become negative in thinking about what is our meaning in life? What is our purpose? If this is what life has to give me, what is my meaning and true purpose to engage long term with the stress and what I have to endure? So these four areas are so important because they come to the core of who we are. And without dealing with stress effectively, even if one of those areas is touched upon, then we're not living the good life. We're not living a fulfilled life. So over the next number of what time we have, I want to kind of piece that out of how do we look and keeping those four areas in mind, because my goal is to ensure that everybody has the best when it comes to each and every one of those elements. Because I don't want anybody to have not as good of a life if one of those areas is impacted upon. So how do we know if we're stressed? Well, if you're like me, usually the first sign is I get sore shoulders. I get a headache. I feel like I'm not there in the moment. But a lot of it can even just be simple as chronic pain. Not knowing why we feel achy, why certain body functions aren't working the way they used to. I mean, I'd like to chalk it up to age, but sometimes it can be because of stress. When I'm stressed, I carry it in my shoulders and my back. Oftentimes, other people, when I talk about, they carry it even sometimes in their hands. They'll do things such as wringing hands or doing things that cause a body sensation. Another way that we can see that, maybe I'm dealing with too much stress is we're not sleeping right. We have insomnia. For some people, it can be trouble falling asleep. For others, it can be no problem falling asleep, but then waking up 1, 2 in the morning and then watching the clock the rest of the night. We can see symptoms of stress in our relationships and our engagements with others. If you have a significant partner, significant other in your life, if there's a change in sexual relations, that can often be a result of increased levels of stress. Sometimes we can see it manifest in digestive problems. It can be either overeating or undereating, or even having difficulty digesting food after we have consumed something. We have symptoms such as difficulty concentrating. I know for me, it often manifests in having trouble making decisions, where I end up thinking too much about what I should do as opposed to thinking what I'm actually going to do. So having difficulty in concentrating on the steps necessary to overcome something can inhibit our ability to make good decisions. Another one is fatigue. I'm just tired. I'm tired and I don't know why. Well, if we're not addressing what's going on in our day, then it can add up. And oftentimes we just go, you know what, I'm tired. I don't want to see anybody. I don't want to talk to anybody. I just want to disengage. That's another symptom that possibly we're dealing with too much stress. Last thing, are we overwhelmed? Do you feel like, wow, I just can't take any more? Am I irritable? Am I fearful of what the day is going to entail? Now, if any of us feels any of those things, then we got to ask ourselves, what is going on in my life? And what are my steps that I need to take to address them? We have collectively in our society an inability to take care of ourselves. We often take care of others better than we take care of ourselves. But if we're going to have this realistic conversation of what stress means, this is about self-care. This is about how we can start putting that mirror on ourselves and taking a hard look of what's going on and asking yourself, am I really addressing everything that's going on in my life? And am I giving myself the credit that I deserve, knowing I'm going through very difficult times? If we don't take care of ourselves, unfortunately, science is behind some very scary evidence of what stress can do to our bodies long term. We have found as a research community that stress over time damages our bodies and sometimes in irreparable ways. It can be tissue damage, immune system breakdown, heart problems. There's a lot of evidence to support cardiovascular health in relation to stress. Our nervous system can be damaged, including the brain as well. And right now, research has linked autoimmune disorders as one of the fastest rising diseases that is hitting Western society. And a lot of that is being attributed to the levels of stress we have in our life. And people who have autoimmune disorders often don't have a lot of evidence to suggest how it came on. But when you look at the history and the medical history of individuals who do contract autoimmune disorders, very often we see high levels of stress in their lives. And there's often a triggering event, and stress being an often contributing factor to it. Right now, autoimmune disorders is the third ranking disease category besides cancer and heart disease in the Western world. And largely that's attributed to the stress levels we face every day. So now I'm into the negative. Let's talk a little bit more about what it can do. If stress continues with individuals, not only do we see the health effects, which are so devastating, we see it in our everyday life. Our patience wears down. We're not as engaged with our family and our friends. We procrastinate. We put things off. We can become critical and judgmental of ourselves and of others. We can cry more easily. I'm a great proponent of crying. I think it's a great way to get it out. But if we see ourselves crying as a result of the stress on a more regular basis, then that's when we have to start taking our symptoms into more account and really address what's going on. Stress long term can manifest in frustration, anger, resentment. Sometimes we're stressed in our work environment and we can take it home and be frustrated and resentful in our home environment, even though that may not be the source of the stress in our lives. Sometimes you feel like you can't hold it together, and the most simplest things can trigger an emotional breakdown. That is absolutely common when we see individuals who are undergoing very, very high levels of stress. We often doubt ourselves and our ability to do self-care. And in times of stress, we often use the old adage, can't see the forest through the trees, because we can't effectively examine all the elements of stress and what it's doing to us. But what stress can do over time if we don't address it it leads to things what we call burnout or mental exhaustion, where I just can't take one more thing that's going to happen. What we've also seen on the research side is if individuals don't effectively deal with stress, mental health conditions can arise. And this is where, from a research or a clinical perspective, psychologists are very concerned collectively about our levels of stress going on right now. So, what it does, if elevated levels of stress, that means you can be at higher risk for developing mental health disorders. And I'm going to just name a couple of common ones that are more likely to be associated with high levels of stress. Well, the first one will be generalized anxiety. Now, this is a condition that's commonly characterized by uncontrolled worrying about everyday events. And that often, stress levels and anxiety go hand in hand if stress levels remain unchecked and untreated effectively. Another thing that can develop in individuals is called panic disorder, where this can cause panic attacks, where there's extreme fear that happens, sometimes which is accompanied by physical effects, just pounding heart, shortness of breath, difficulty, the breathing, fear of like an impending doom type feeling. And oftentimes people will present to the emergency department thinking that they're having a heart attack because the symptoms are so similar to what we see in cardiac events. But sometimes it'll turn out that it is a panic attack, and it is as real physically to the individual who's undergoing it. But we also see the high association with stress levels and panic attacks. We also see the development of post-traumatic stress disorder develop in individuals who are going through high levels of stress in their life as well. PTSD is a condition characterized by things like flashbacks, high levels of anxiety, typically as a result of a traumatic event or traumatic events that are cumulative over time. So we do, again, see that association. Another type of mental disorder that we can see in individuals with high levels of stress is social phobia. And this condition causes intense fear and anxiety in situations that involve interactions with others. The last type of disorder we can see is obsessive compulsive. In this condition, where we see individuals who have repetitive thoughts and a compulsion to do certain rituals or events. And often that is a result of the anxiety that's going on of I'm going to control one element, and if I control it, then it'll reduce other areas of signs and symptoms of stress. Stress is, like I said in the beginning, it can have both good and bad effects. And I know I'm talking a little bit more of the negative effects, but it's important to highlight these so we can recognize them, talk about them, because they happen to each and every one of us. It happens in times of our lives when you probably go, this is not convenient. This is not the time that I need to deal with more. But it also allows us the potential to grow from it and learn from it. To me, over the years of engaging in so many different elements in my professional career with wonderful people in my community that I've been so fortunate to learn from, is understanding that in order for us to grow and learn as people, oftentimes we need something to push us. And sometimes those are the elements that are not so great in our lives. Those are the negative events. And not wishing that upon anybody, but that unfortunately is a reality in our lives. And you have to look no farther from this past year in the pandemic, where so many people are struggling from financial difficulties, from job loss, from lost family members to this horrible pandemic. to struggling with juggling job versus school. I mean, it's endless the amount of pressures that we have right now in our society. And yet we are resilient. We are learning of how to adapt and cope. But in talking to colleagues and friends and family, what we often don't do is pat ourselves on the back and go, you know what, I'm doing okay. I It was a tough day and I struggled, but I got through it. What we often don't do is ask ourselves, how did I do it? Why did I get through today? And we have to give ourselves a lot more credit for what we can endure. And when we have to say, you know what, I need a timeout myself to recoup and understand what I'm feeling, what I'm going through. Because stress, as we just talked about, is important in our lives because it tells us, it's a wake-up call. It's a way that our body tells us, you know what, you're going through a really difficult time dealing with a myriad of issues. But the fact that we're talking about it and getting through it is because we're very resilient and we can withstand a lot. So I want to pause right there to say, let's give ourselves the credit that we all deserve to deal with stress effectively. For those who struggle with how to deal it effectively, there are so many resources available. There are so many uh, ways to develop skills, whether or not you want to utilize the services of a mental health professional, or if you want to take on the skill building yourself. Whatever works for you, I implore you to use. What works for me may not work for you, and vice versa. But it's the fact that we're trying to learn from it and be able to better withstand the next time that we have a stressful day, to me, is the most important thing to consider. So going on from there, I'd like to talk about what happens over time with stress. We seem to talk about a lot in the last number of years of what's called burnout. But what I want to talk about and piece that out a little bit more, what burnout really means is I'm mentally exhausted. We often, can easily talk about the effects of being physically exhausted. For those who engage in a lot of physical activity, or even on certain events where you do things that you haven't done for years and you go, oh, I'm hurting the next day, but I've done something to physically exert myself. And we often take a couple of days to recoup and we relax. We, spend time to get our muscles back to feeling the way we are. But we tend not to do that when it comes to our mental health. We often get to the point of mental exhaustion when all the signs were there leading up to that. And to me, talking about mental exhaustion should be absolutely the same thing as talking about physical exhaustion. You get to the point where you go, I have to take my mental health into consideration, and I have to take a break and let myself build up reserves again. So when we talk about mental exhaustion, that happens typically after long-term stress. It makes you feel overwhelmed. You're emotionally drained. And even your everyday responsibilities can almost seem impossible. I'll give you an example. Even just the other day, I was driving with my daughter, and she's 10 years old. She talks a lot. She's loves in the car. There's no need for a stereo or a Sirius XM in my car because my daughter talks, and I love it. But we had driven about 20 kilometers going around town, and we reached our destination, and I realized I had no idea what she said. I was nodding. I was saying yes. Oh, that's great. But when we arrived at where we were going, I sat there before I got out of the car and I go, I couldn't tell you what the conversation was about. And that came on the heels of several events that were going on in my life where I go, I'm mentally drained. And what that meant was I wasn't present. I wasn't there. Even though I was physically there, I mentally wasn't. And instead of kicking myself, I'm glad I recognized it. But it taught me of go, okay, Krista, you've got a daughter, you've got obligations. If you're going to be there for her as a mom, you got to take care of. I got to take care of myself. So it was an eye opener for me. Even though I practice this in my daily life, I still catch myself sometimes of feeling drained, overwhelmed, and being able to recognize that. Then I went back into learning the steps I need to take to do self-care, and so I can be there in the moment. But what mental exhaustion means is people who are at that point can easily become disengaged, can become depressed, have anxiety, are pessimistic about life. Nothing I do will ever matter, so why bother? It's that hopelessness feeling. There can be apathy, like not caring, detachment, like I just described, where I wasn't present. You can start to feel anger, dread, lack of motivation. It's sometimes really hard to be motivated to do things in our daily lives, whether it be in our personal or in our work obligations, to feel motivated if you're feeling mentally exhausted. How do we look for that? Well, it can be as simple as recognizing it in a car ride of, I haven't been listening. But sometimes it can manifest in ways of headaches, upset stomach, body pains, chronic fatigue, changes in appetite. Our body's pretty good at giving us the signals that we need to look for. But we're often not caring enough on ourselves to look for those signs. So part of the work that I do to help people understand what stress can do is also teaching them how to look for those signs in themselves. We often can easily recognize it in others, but when it comes to ourselves, we kind of shrug it off and say, no, I'm fine. Even sometimes when we're not fine. Another thing that often happens, and it happens with a friend of mine, and I criticize her every year, every winter. I would say by February, March, she's not a winter, it doesn't help because our winters are horrible, but she gets run down. She's taking care of everybody, but literally by February, March, she's got a flu, she's got the cold, next time that she's well for a few days, she's sick again. And this goes on for about a month, sometimes 2 months. Every year I go, it's because you've let stress in your life reduce your immune system, reduce your coping strategies. You're not taking care of yourself, and we easily get run down. And what happens? We're susceptible to viruses. That is absolutely key to the conversation now, given our current COVID situation. So the more we're run down, the less likely our body can fight these things that are in our environment. Another thing that we can look for are behavioral signs. How is our performance at work? How is our performance at home? Are we socially withdrawing and isolating ourselves from others? Do we have inability to keep our commitments, both at work and at home, financially? Are we calling in sick more often? Sometimes it is okay to take that mental health day, but if there's a pattern that's repeating ourselves because of feelings of overwhelming, that is also another sign that we're at a point of mental exhaustion. So is there a difference between stress and being mentally exhausted? Well, like I said, everybody deals with stress. If you figure out the secret to escaping stress in your life, I would love to hear it. But unfortunately, we all undergo stress. And again, it's our body's natural way to deal with these situations. As I said, biologically, our body is adept at dealing with stress. But if we let it build up over time, mental exhaustion can kick in. And we continually try and strive to do more things in life, to change our environments, to challenge ourselves, which is wonderful. But if we don't take the time to do the self-care that we need to recognize the levels of stress in our lives, those self-care techniques may not be as effective as you hope them to be. So I want to ask each and every one of you to ask yourself some basic questions. Ask yourself, how are you doing? And we often don't do that. When we meet people, that's a common thing we say to each other, how are you doing? But every day, I ask myself, how am I doing? And it's a legitimate, and sometimes it's a very hard question. But we have to ask ourselves, how are we doing? But we also have to put it in context. How are we doing at home? How are we doing at work? How are we doing with friends? If we're disengaging in any one of those areas, but doing well in others, that still is an indication that we have some high level of or elevated levels of stress in our lives. Another important question to ask is, do you have the energy to give yourself to others? So oftentimes when we start to examine where we are in our lives with our levels of stress, if we have an inability to give back, to engage with others, because we just don't have anything left in the tank, then that's an indication that there's time that we have to reach out and possibly get help from others. Another question I ask a lot of people, especially in the fields that I work in, do you have a good work-life balance? Very often in times of stress, we don't. We often give more to one area to avoid possible stress in another. We can become workaholics, or we can avoid work altogether and concentrate at home because maybe it is work that is causing the stress. So the most important question to ask is, do we have a balance? Because at the end of the day, we have to have that. We have to be able to get fulfillment out of work, but also fulfillment out of life. And if you're struggling to maintain that balance, then there are many, many resources to help determine how to better ensure that balance is there in your life. Most important question I always ask, how are you eating? How are you sleeping? Do you dream of a better life? And oftentimes when we're stressed and we're not sleeping or we're eating, we're often thinking about what could be. What is it I'm missing? What is it I need to do? So if any of these elements are occurring right now in your life, then again, we have to talk about what's your level of stress. So these are all indicators of how do I measure what's going on in my life right now. Another thing to ask yourself is, are you irritable? We often don't recognize how irritable we are when we're irritable. Sometimes it often comes from a good friend of going, what's wrong with you today? Why are you different? Why are you mad at the world? And sometimes those good friends are our wake-up calls. It is my hope that we have that ability to see in ourselves that sometimes when levels of stress are so heavy on the shoulder, we often need those good friends and family members around us to help us see what we often don't see right in front of us. So now that we've talked about stress, I want to talk about mental well-being versus mental wellness. And for years, I'm going to digress a bit. In the field of psychology, when I started many years ago, when I was doing my bachelor degree, and in the beginning, I learned the history of psychology. What is it that it was meaning to do from a discipline perspective? And it was often developed and explained over time as a way to describe the negative side, the abnormal psychology, the mental health disorders that people are presenting, the the difficulties that we face in society and how we deal with it. So over time, psychology often was seen synonymous with effectively dealing with mental health disorders. And I'm a huge proponent of what's called positive psychology. And what that essentially means is we don't have to be, let me say, it, to be mentally well is not in the absence of being mentally ill. So, in other words, we often think if I don't have a mental health disorder, that must mean I'm mentally well. And I describe it, it's not two ends of one spectrum. Because oftentimes, in the absence of mental illness, doesn't necessarily mean that we have fulfillment and that we're well. So to me, the to advocate of what psychology and mental illness and stress and all of these very important terms really comes down to how do I avoid the development of a mental illness as a separate thing of what do I need to do to bring mental wellness in my life. And we have to work on both. They're not, like I said, two ends of one spectrum. And it's important to take the context of how to be mentally well is actually going to lead us into how to be resilient over our lifespan. So in order to be mentally well, it means not the absence of stress, but how to more effectively deal with it because we have the stress in our lives. So how do you achieve that physical, that mental, that emotional and spiritual well-being in a very chaotic and stressful life? Well, it means that you have to utilize skills and challenge yourself to deal with the stress and put it into context with certain life skills. How to adapt when things and when life throws curveballs at us, how to more effectively disengage from the event, and how to incorporate strategies to develop long-term abilities to be well. So, mental illness, as every other physical illness out there, can take many forms. And it can be associated with stress in our lives and can be associated with many other factors for the cause of mental illness. But it is normal to feel off some days. But that doesn't mean that there's the development of severe mental illnesses. For anybody who's listening who does feel that they're in that end spectrum of mental illness, there are many, many resources out there. And if anybody needs more information of what resources could be available in your area, I'd be very happy to answer those offline in a confidential manner and provide that information to you. But in more general terms, dealing with the effects of mental stress is how to incorporate strategies in our daily lives to possibly prevent the development of mental health disorders. They may occur, but my goal is to prevent them as opposed to having to deal with them after the fact. Because in a lot of times we can't, not all, but sometimes we can prevent if we engage certain strategies in our life. I'm just going to talk very quickly with respect to mental illness and some factors that may precipitate the development that are above and beyond stress. These are things such as having a biological relative who has a mental disorder puts you at higher risk for the development of certain mental health conditions. If you had exposure in utero during your mother's pregnancy, if you're exposed to certain environmental or like examples could be poor nutrition, alcohol, drug use, exposure to viruses can also increase your chances. Undergoing lifelong stressful events, as we talked about on this webinar, such as financial difficulties, relationship problems, those also can precipitate mental health disorders. For individuals who are dealing with chronic other medical conditions, also put you at higher risk. Undergoing traumatic experiences. Alcohol and drug use can also be a risk factor. Being subjected to abuse as a child or neglect as a child. But another important one is our social environment. Having healthy friends and family around us. But if in the absence of that can also lead to the development of mental disorders. Why this is important, because I want to put it into the broader context that stress is absolutely related to every one of those elements, but it's not a definitive cause of mental health disorder. So I want to make sure that we really have that conversation of the importance of what stress can do, but it's not a determination definitively that a development of a mental health disorder will occur if you're undergoing stress. But again, it is a very difficult thing on our body if we don't deal with stress in the long term. One thing I want to highlight, most importantly, is that whenever we deal with, regardless of if it's a mental health illness or it is stress levels, we can all recover from them. Most mental health disorders are a lifelong disorder. You can go into remission from it, but it is something that can occur again at any point in our life if we don't take the steps necessary to treat ourselves effectively. But in when it comes to stress, mental health disorders, for the most part, all mental health disorders are treatable to some extent, whether it be through therapy, such as cognitive behavioral therapy, or medications. It is a treatable condition. And I implore anybody who is unsure of where they are on the spectrum of their mental health to seek out guidance from a mental health practitioner, professional, or even their family doctor, because it's better to ask and gain insight if there's difficulty in understanding the symptoms that you may be facing, than trying to determine on your own what all of these symptoms mean. So at the end of the day, it is always, always key to, as our physical health, our mental health, to seek professional advice in times where we feel that we can't deal effectively anymore with our symptoms. The last thing that I'll end upon tonight is talking about our levels of our coping. We all have reserves, and we all have our ability to have different levels of reserves at different times in our life. Unfortunately, this past year, I mean, if you see anything on social media, everybody's waiting for the end of this year. It's going to be the biggest party come December 31st of 2020 of this has been the worst year that most of us in our collective memory has experienced. And I even remember when I was at work and my boss met me in the hallway and he said, the WHO's just declared this as a global pandemic. And I looked at him and I said, well, what does that mean? And realistically, I don't think any one of us thought this could happen. A year ago, if anyone were to say, guess what, next year you're going to be working from home, you're barely going to see your family, your kid is going to be homeschooled, and you can't travel or take vacations, I would have said, what planet are you on? That's not going to happen. And yet, my description of my reality is vastly different from so many people that I've encountered in the past year, where the utter devastation of what this pandemic has done is indescribable. But at the same time, we have this collective ability to have what I call reserves. So to end tonight, before our next topic of getting on resiliency, is take a really, really good look of your level of reserves. And what that means is, this is our ability to withstand. This is our ability to put ourselves in check any day. Our reserves change sometimes from minute to minute, depending on our circumstances, to day. But in the times where we feel depleted in what our ability to bring ourselves to the level where we need to be, there are some few little things I'll leave you on. First is, be kind to yourself. It is absolutely key in this stressful time to be kind to others, but most importantly, to be kind to yourself, because you can't give to others if you're not giving to yourself. Well, how do we do that? Well, for me, it may be a walk around the block. It may be having a game of cards with my daughter, or taking time to FaceTime with my family back home in Nova Scotia. Whatever it may be, it can be 5 minutes of that, but that increases my reserves at any time. If I don't do that, I can't give to anybody the next day or the day after. So maintaining our physical health is just as important as our mental health. So take those time. It doesn't need to be long, but take that time to do something for yourself. A lot of my friends, play hockey, or some are looking for the winter to go skiing, whatever it may be. Do something physical, because when we do something physical, it has so many benefits to our mental health. We also have to attend to our personal relationships. That means our family, our peers, our colleagues, our neighbors. By attending to those, we can build our reserves up again. We are very social people. Without that engagement with others, we lose sight of meaning in our life. So on times where you may struggle to know, how do I get back to myself again? Attending to others can help build up that reserve in you again. Last thing is, engage in meaningful, healthy activities, whether it be volunteering, joining groups as socially distanced and responsible as we can, at our church or our places of worship. Those are important to us to maintain a level of activity in these unprecedented times. These are simple techniques, but they're very, very effective. So I'm going to end tonight on the acknowledgement that, unfortunately, this is a very difficult time for each and every one of us. It is normal to feel stress. It's actually healthy to feel stress. What is unhealthy is if we don't acknowledge the role of stress in our lives. And in the coming days, Daryl and I are going to meet again, and I'm going to go over some very practical terms and use the science and the research behind what resiliency is. I like the term resiliency, but a term I like better is called mental toughness. It's grit. What can we use in very easy, doesn't cost a thing, effective ways that will allow us to acknowledge the stress in our lives. But instead of letting it overwhelm and exhaust us, we go, we're going to take it on head on, and I'm going to deal with it in the most effective way I can do right now with what I have. So thank you for tonight. And thank you, Daryl, for inviting me. I hope some of the topics on stress weren't too stressful. Thank you, Daryl.
Thank you very much, Dr. Richard, and we absolutely look forward to your next segment. If anyone has any questions in the meantime, please email them to info@kipfoundation.ca, and we'll make sure that they get to Dr. Richard. Krista, we look forward to talking to you again very soon.
Thank you.